This is a presentation on communication disorders in young children, brought to you by Vicki Schaefer for SPED 811, Characteristics of Early Childhood Special Education. First, we're going to look at speech development. Normal communication development has several developmental milestones in the first 5 years of life. Very important is to pay attention to the milestones from 0 to 1 years of age and 1 to 2 years of age, although throughout the first 5 years are all critical components of learning language. Parents should definitely monitor their children's speech and language development, especially during the critical first year. This first year is critical for the development of language syntax. Even though the children do not demonstrate syntax at this time, it has been shown to lead to later syntax development. For the first 6 months, very important things to look for are sounds like cooing, happy sounds, unhappy sounds, crying, fussing, making a response, and noises when spoken to. In the first 6 through 12 months, the child begins to understand some words and may say things like baba, mama. They react to sounds, faces. If they're not showing those reactions, that is a definite sign that the child probably has a communication disorder. During the first year, they should say their first word, but sometimes that development takes a little longer. For the first to second year, at the beginning, nonverbal answers should be given. If you ask the child simple questions, they might shake their head or nod. They can usually use 2 to 3 word labels for objects. They try to imitate simple words. If you're telling them things, they try and imitate you. And their vocabulary increases from approximately 4 words to 50 words. At the 18 to 24 months, their vocabulary goes from 50 to 250 words. The child can make animal sounds. They will say common foods by name, like milk or pudding, usually single syllables. They begin to use pronouns such as mine. They understand gestures. In 2 to 3 years of age, there are a lot of vocal milestones. The basic thing that you're looking for is the vocabulary increases. The child starts talking to themselves. They start interacting with other children and adults more. They understand that items are owned by other people, like daddy's car. They start using plurals. They answer questions like what are you doing, where are you going. They can follow 2-part instructions. And usually, if you ask them about something like where are your socks, they can point to those items when they're asked. 3 to 4 years of age, we're looking at an increase of up to 1,500 words in their vocabulary. There should be a lot of talking. They can identify colors. They may still be struggling with some consonant sounds, but they are able to describe what they're doing and what they're doing it to. They can follow 3-part instructions. They use more complex sentences. They start using pronouns instead of saying like boy. They might say he. They start to use contractions and quantity words. 4 to 5 years of age, we're looking at preschool and going into school. They understand very complex spatial concepts, things going away, things coming back, things being on top of. They listen to conversations and they engage in conversations. They can pronounce longer words but may struggle with words like hippopotamus. They should be growing out of the stage where they struggle with their consonants. They can understand shape words, colors. They use past, present, and future tense. They use irregular plurals such as mice instead of mouses. They can understand quantities over or up to and sometimes over 5. They ask what words mean and they remember them. If the milestones on these pages are not met, then definitely a consultation should be done with the family doctor. Communication disorders are when the child has trouble communicating with others. It's a very critical survival skill and is also essential when the child goes to school or to learn from others. The earlier communication disorders are detected, the better it is for the child. Definition of communication disorders: it is where a child has a problem understanding what others are saying or expressing themselves in a way that is understandable. This is a fairly common problem. 1 out of every 10 children have some kind of communication disorder, though often these are mild communication issues. They can involve a total or partial lack of speech ability. Signs to look for. The child is not hitting their speech milestones in those first 5 years. They don't smile or interact with others. They have unclear speech. Sometimes they repeat speech sounds. They have trouble playing and talking with other children. Often you'll see them playing by themselves. They won't speak to the other children. They have trouble developing their early reading and writing skills. Here is an example. If they struggle to talk, they haven't acquired many words. There's especially on the speech and not interacting socially. Early detection involves the parent and caregiver monitoring those milestones, making sure that the child is developing as they should. There are several available early childhood screenings. Take advantage of those. There are usually school districts offer a screening at 3 so that children with the developmental and communication disorders can start getting interventions early. Ask your doctor for a referral to a specialist if those developmental milestones are not being met, such as an audiologist, neurologist, or a speech-language pathologist. Also ask to have your child tested for psychologically. We want to see if they're having a processing issue or a mechanical issue, and even it can be the result of brain damage, so having an MRI or CT scan done can be very important to finding out what the problem is. Causes of communication disorders. Sometimes it is a brain structure issue due to abnormal development, some kind of exposure to a toxin. There are genetic factors. There can be traumatic brain injury, a stroke or tumor. There are neurological disorders that can contribute. Physical deformities in the palate or vocal cords, and even psychological and cognitive disorders such as autism or intellectual disability can cause communication disorders. Here is a chart looking at what areas of the brain may have a malformation or tumor depending on what type of communication is being disrupted, such as cognition or thinking. That's usually in the frontal lobe. We have communication, emotional self-control can even be an issue, and then physical issues can be with the muscles and nerves themselves, or it can be a brain dysfunction. Types of communication disorders. There are language disorders, which has to do with communicating overall. It has to do with producing or understanding all types of communication, not just verbal. Speech disorders have to do with speaking, and they can include a lack of fluency, an inability to articulate, or even just the inability to produce voice. Auditory processing has to do with hearing impairments as well as cognitive disorders, such as aphasia, which causes the words to sound a little scrambled as the child is listening. Then we have social communication disorder, which is where the child is not developing proper communication skills with others. Impacts from communication disorders. They have a profound effect on the child's ability to be accepted by and to engage with peers, family, community. They have a hard time developing patterns of interaction with others, learning new skills, expressing themselves and what they need, and they really struggle with transitions to new environments and expectations. A child who cannot communicate is almost entirely unable to learn and achieve in a classroom, and eventually there's an impact on their ability to be employed and to fulfill their other life tasks, moving out on their own, having children and family. All these things are very involved with being able to communicate. Treatment. Therapy is a major form of treatment, and it is based on individual needs, depending on the type, cause, and severity of the disorder, the age of the child, and the health of the child. Different types of therapy. There are speech-language therapy, behavioral therapies, family therapy, and personal counseling. Other types of treatment can include providing assistive technology for the student so that they can use some kind of device to help them communicate, the provision of medication for medical-based communication disorders or attention deficit disorders, and then accommodations and modifications, which are things that are done in the environment, such as if the child can't understand what is being said, having things written out, modifying the environment so that there are fewer distractions, or that giving the student one-on-one attention to help them process slower, to work on their skills. Educational considerations. For a student to function and learn in the school environment, they need to be able to communicate. Most students without or with communication disorder require some kind of academic support, either through a 504 or an IEP. Qualifications for these are that the student must demonstrate voice, fluency, phonological, articulation, or language disorder, Any other communication disorders are classified under other qualifying conditions. Services that would be provided in the school environment include speech-language pathology services, counseling services, and social behavioral therapy. In addition, the academic side would receive accommodations and modifications, generally including some form of assistive technology for communication, computer-based learning, and other curriculum modifications and accommodations based on the student's academic need, such as someone to read for them if they can't read, or write things out that are being said if they can't take notes, things of this nature. Role of the family. Families are very important in helping a student cope with and sometimes overcome a communication disability. The first way that they can start is by fostering language and speech learning at home. From the time that baby is born, parents need to pay attention. They need to engage in speaking to the child, working with the child, playing the games that will help that child develop and start learning language. And also, it helps if there's a change in that child's perception, then the family will notice when, say, communication skills stop or the child becomes withdrawn. Other ways to help the child are singing songs with the child. Even when a child has a communication disorder, sometimes singing songs can help access parts of the brain that aren't reached by normal speech and can help remodel the developing brain. Play listening and storytelling games. All kinds of speech-involved games, rhymes, saying things like Little Tommy Tinker and working those tongue movements. Those are all things that families should do on a daily basis with kids and their developing speech. Also, the more that the child is worked with, the more likely it is that any kind of communication deficit is going to be detected early, so that therapy can start with that student if necessary, or even that it can be identified what kind of problem they're having. Parents need to create a supportive environment at home for the child. If the child is having trouble, say, saying his consonants, they need to not make fun of him for talking with a wisp. They need to, tell him it's okay, work with him or her, and focus on the child's strengths and giving them support and pride in other ways so that they can work with them on the areas that they need help. Doing family therapy with the child, speech therapy, as well as counseling therapy are both good things to help both the child and the family deal with the situation and work to support each other. Work with the school's IEP team, take advantage of those early identification things that are in place to catch these disorders early and help children as soon as possible. Also, with the IEP team, the students with communication disorders will always need some extra help in going from, say, preschool to kindergarten and then moving up in the grades because requirements get harder. Communication becomes more and more important. So working with the IEP team, the family can make sure that the student is getting the supports that they need, that the child is getting the help that he or she needs, and the appropriate accommodations. Make sure that the child receives interventions. Make sure that the child, once they are identified, is taken to the services they need, whether it be a medical doctor, a psychologist, a psychiatrist, a speech pathologist. Get those children to their appointments. Make sure that you're supporting the interventions. Also, learning and using sign language in the home can help. Even if the child doesn't have deafness, they can still use sign language as an alternate form of communication that can be used anywhere without an assistive device. Also, making sure that students who need it have access to some kind of assistive device to help with language can help that child feel better about themselves, communicate what they need to people, be less frustrated, act out less, because they're able to communicate with others. And that's really where it all starts, is at home. Finally, our references. Some of the best references for families were through the American Speech Language Hearing Association. There were several things about identifying the signs of communication disorders and talking specifically about the needs of children with speech and language disorders. Another good source was through I Communicate. They had things about different assistive technologies that are helpful with students with communication disorder. They also had some very good things about identifying and dealing with speech disorders. I really think the I Communicate had the most family-friendly and direct information, but ASHA also had very, very thorough and easily to access information. Thank you for watching my presentation.